Assalamu alaikum warahmatullahi wabarakatuh. Hello Journal Club listeners. Today we'll be talking about management the abnormally large apical foramen, especially with apical periodontitis that poses a challenge in achieving strict apical sealing using our conventional root canal treatments. So the options we have to manage these types of cases, the large apical foramen, are calcium hydroxide, which has traditionally been used in epixification procedures, but they have some weaknesses that limited their use, which are the unpredictable outcomes and lengthy treatment periods, and it has been shown to reduce the mechanical properties of radiculodentin. The second option we have the MTA, which has been used as an apical barrier due to its favorable properties, including biocompatibility, the low solubility, mineralized tissue formation, and sealing ability, as we know. However, it has some difficulties in their manipulation, and they have potential to discolor the tooth. So in response to these limitations, calcium silicate-based bioceramic materials has emerged as an alternative with improved biocompatibility and an immediate apical barrier formation capability with a shorter setting time. So a Chinese group conducted a study which was led by Wang that was published recently in November 2023 in the Australian Endodontic Journal. They evaluated the long-term outcome of apical barrier using the bioceramic material iRoot BP Plus evaluated in immature roots over 6 years follow-up period. They aim to assess the success of apical barrier in adult permanent teeth and analyze what factors that could influence the healing of the affected teeth. For the methodology, they included 50 teeth in permanent adults aged from 18 to 40 years old, with no systematic diseases, not taking any medications. They included immature teeth with incomplete root development and apical periodontitis. They had no mobility or periodontal probing depth, and the root length was more than 10 millimeter with no root fracture or resorption. So they placed the 4 to 5 millimeter thick apical barrier and backfilled with warmed gutta percha. The patients were followed up at 1, 2, and 6 years. The outcome was evaluated according to the patient's symptoms, the clinical findings such as pain, discomfort, the presence or absence of sinus or abscess formation, percussion reaction. They checked tooth mobility and any pathological probing depths. The treatment was recorded as failure if any of the mentioned signs and symptoms were found, and the imaging findings based on the PIA by Orstovic were evaluated. They had a high recall rate of 91%. For the results, during the first year follow-up, out of the 50 teeth, 35 were completely healed, and 10 were in the process of healing, and 5 were defined as failure. 2 of them were extracted due to fracture. And in the 2 years evaluation period, 3 patients developed apical abscess due to root fracture, and on the final 6 years recall appointment, 4 patients were lost to follow-up, and the remaining 38 teeth were visited clinically and were judged successful based on clinical and radiographical evaluation. And only 1 tooth at the 6-year follow-up revealed external resorption, which was considered as failure. This study suggests that the use of iRoot BP Plus, the bioceramic material, as it's gaining its popularity in the recent years due to its favorable clinical operability and shorter sitting time compared to other bioceramic materials such as the MTA. The nanoparticles incorporated in the material can penetrate the dentin tubules and form a mechanical bond with the water and dentin, resulting in a material stability upon solidification. And they exhibit similar antibacterial effects to MTA, particularly against E. faecalis. And considering the high success rate of 97.4% at the 6-year follow-up and the good clinical efficacy, the results of this long-term study suggest that the iRoot BP Plus apical plug technique can be used as an alternative bioceramic material for periapical periodontitis treatment and permanent teeth with open apices. Finally, it is noteworthy to mention that they had a small sample size included, and their hypothesis on the reason of failures they had, which was the root fracture due to the lack or delayed placement of the final restoration, which is in accordance to the findings of the available studies in our literature. However, Further investigation regarding the timing of crown restoration during the apical lesion healing in open apices is definitely an area worth exploring. Thank you so much for listening. Hope you have a nice day. Bye bye.